Welcome, students, to today's lecture on the pharmacology of antipsychotic agents. We will explore neurotransmitter imbalances in schizophrenia, antipsychotic mechanisms, classifications, efficacy, side effects, and monitoring. We'll discuss treatment strategies, long-acting injectables, pharmacogenomics, polypharmacy, drug interactions, and non-adherence, as well as special populations and emerging therapies. Let's begin. In schizophrenia, imbalances in neurotransmitters like dopamine, glutamate, and serotonin contribute to the various symptoms observed. Dopaminergic hyperactivity in the mesolimbic pathway causes positive symptoms, while hypofunction in the mesocortical pathway results in negative and cognitive symptoms. Glutamate abnormalities, particularly NMDA receptor hypofunction, also play a role in schizophrenia, providing potential targets for treatment. Antipsychotic agents primarily exert their therapeutic effects by blocking dopamine D2 receptors, particularly in the mesolimbic pathway. This antagonism decreases dopaminergic neurotransmission, alleviating the positive symptoms of schizophrenia. However, it is essential to note that typical antipsychotics, often referred to as first-generation antipsychotics, are non-selective and block dopamine receptors both in the mesocortical pathway and the nigrostriatal pathway. As a result, these agents can lead to extrapyramidal side effects, such as dystonia, akathisia, Parkinsonism, and tardive dyskinesia. Antipsychotic agents can be classified into two main categories: typical, first generation, and atypical, second generation, antipsychotics. Typical antipsychotics, such as haloperidol and chlorpromazine, primarily block dopamine D2 receptors, leading to the alleviation of positive symptoms but potentially causing a higher risk of extrapyramidal side effects. On the other hand, atypical antipsychotics, including olanzapine, risperidone, and quetiapine, offer a broader receptor binding profile, targeting serotonergic, dopaminergic, and glutamatergic pathways. This broader profile helps in managing not only positive symptoms but also negative and cognitive symptoms. The efficacy of antipsychotic agents in the treatment of schizophrenia has been well established. These medications have shown substantial efficacy in reducing positive symptoms and preventing relapses, leading to improved quality of life for patients. However, it is important to note that individual response to antipsychotic therapy varies, and treatment optimization often requires adjustments in medication dose and augmentation strategies. It is crucial to consider the potential benefits and risks of treatment when assessing the net effect on the patient's well-being. While antipsychotics offer significant therapeutic benefits, they can also be associated with various adverse effects. Common side effects of antipsychotic agents include sedation, weight gain, metabolic disturbances, such as insulin resistance and dyslipidemia, extrapyramidal symptoms, and elevation of prolactin levels. Regular monitoring of these parameters is essential to ensure early detection and appropriate management of these side effects, promoting optimal patient care. Approximately 30% of patients with schizophrenia do not respond adequately to initial antipsychotic treatments. For these individuals, a comprehensive assessment is necessary to identify potential contributory factors and formulate effective treatment strategies. Clozapine, an atypical antipsychotic, is considered the gold standard for treatment-resistant schizophrenia due to its unique receptor binding profile. However, the use of clozapine requires close monitoring due to the risk of agranulocytosis. Other treatment options for treatment-resistant schizophrenia may include augmentation with mood stabilizers, antidepressants, or the addition of long-acting injectable antipsychotics. Long-acting injectable antipsychotics, LAIAs, offer an alternative therapeutic option for patients with difficulty adhering to oral medication regimens. LAIAs, which include medications such as risperidone long-acting injection and paliperidone palmitate, provide a sustained release of the medication over an extended period. This administration route ensures consistent drug levels, improving treatment adherence and preventing relapses. However, proper patient selection, appropriate injection technique, and monitoring for side effects are crucial in the utilization of LAIAs. Pharmacogenomic studies have shed light on the individual variations in drug response observed among patients. Genetic variations in drug metabolizing enzymes, transporters, and drug targets can influence the efficacy and safety of antipsychotic agents. Pharmacogenomic testing can help identify potential treatment options, optimize drug selection, and minimize the risk of adverse effects. However, the integration of pharmacogenomics into clinical practice is still evolving and requires a multidisciplinary approach. Polypharmacy, the concurrent use of multiple medications, is relatively common in the management of schizophrenia. The rationale behind polypharmacy includes targeting various symptom domains, enhancing efficacy, and managing treatment resistance. However, the utilization of multiple medications increases the risk of drug-drug interactions, potential side effects, and medication non-adherence. Rational prescribing and regular medication reviews are necessary to minimize these risks and optimize treatment outcomes. Medication non-adherence is a critical issue in the long-term management of schizophrenia. Various factors, such as cognitive deficits, lack of insight, side effects, and social determinants, contribute to poor adherence. Strategies to improve adherence include patient education, reminders, involvement of caregivers, simplified dosing regimens, and the utilization of long-acting injectable antipsychotics. Collaborative efforts between healthcare professionals and patients are essential to overcome challenges related to medication non-adherence. Antipsychotic therapy in special populations, such as children, adolescents, and the elderly, requires careful consideration of potential risks and benefits. The use of antipsychotics in pediatric populations is generally reserved for severe psychiatric disorders and should be closely monitored due to the risk of side effects like extrapyramidal symptoms and metabolic disturbances. Similarly, older adults may be more susceptible to adverse effects, such as orthostatic hypotension, QTc prolongation, and cognitive impairment. Individualized treatment plans and regular monitoring are vital to ensure safe and effective use of antipsychotics in these populations. Advances in research continue to enhance our understanding of the pathophysiology of schizophrenia, leading to the exploration of novel treatment options. Emerging therapies include glutamatergic modulators, such as N-methyl-D-aspartate receptor agonists, glycine transport inhibitors, and other agents targeting novel receptor systems. These therapies aim to address the different neurotransmitter imbalances observed in schizophrenia and offer potential alternatives for patients who do not respond optimally to conventional treatment approaches. In conclusion, understanding the complexities of antipsychotic pharmacology is essential for providing effective care to patients with schizophrenia. This includes knowledge of neurotransmitter imbalances, mechanism of action, classification, side effects, and monitoring. Treatment strategies and emerging therapies offer hope for improved outcomes.